Hey everyone, we are still dealing with some crazy technical difficulties that I'm hoping will be over this time. We're going to try using headphones and seeing if that makes a difference with our feedback. And if we can get Suzanne on if we don't get any feedback that way. I do not want to have to reschedule her because I'm so excited for you guys to learn from her. She's got so much knowledge, so I'm hoping. Fingers crossed.
Is it working?
All right. Is that any better?
Yeah, I don't hear any feedback.
Okay,
Yay!
so making some feedback. Oh my gosh, thank you so much. This is like crazy. I'm just frustrated because I wanted us to be side by side, and and this is where we talk about. If we're going to be talking about anxiety right now, like I'm getting anxiety because I'm like, okay, I went through, I saw how do we add side by side, how does this work, and then when things don't go as planned. So maybe you can talk about that too, like when things don't go the way we planned, how do we deal with that? But I do want to introduce you, and I know we've got some people popping on live. This video will be shared to the Making Cancer Fun website and also onto our YouTube station. The reason we're going live today on my public page is because Suzanne's going to really talk about stuff that's relevant for everybody. And so we wanted this to be access to everyone, even if you're not dealing necessarily with a medically frail child, because we all deal with anxiety. Like I'm dealing with anxiety right now, right? But let me introduce you to this incredible woman. She is a licensed clinical social worker, and she's also a certified school social worker. She actually has her master's degree from NYU in social work and has her bachelor's in psychology from the Ramapo College of New Jersey. She currently has a private practice in Bergen County, working in, providing private therapy. And what I really love about Suzanne is she has a very extensive background in CBT, which is cognitive behavior therapy, which is kind of what most people think of when they think of therapy, but she also has a background in DBT. And I'm hoping I'm saying this right. It's dialectical. Is that how you say it?
Dialectical behavioral therapy.
Dialectical behavior therapy. And that's really like for elevated trauma and stuff like that, right?
Yes.
Yeah. So this is really like she's gone above and beyond maybe what a normal, somebody who's just doing regular CBT would know. She is highly trained in supporting parents, which is one reason we're having her on today. She has extensive backgrounds in working with children and teenagers, the LGBTQ community. She works with high-risk adolescents who have histories of depression, self-injury, suicide, and she really helps families and adults work through the grief process. She often works jointly with her clients, with the parents, so they can really create like healthier boundaries, communication, relationships. And what I thought was fabulous, particularly for our contact, in context of what we're talking about today, is that she regularly facilitates therapy groups for teenage girls who are dealing with depression and anxiety. She also puts together a really unique, it's called College Readiness, and it's a group for high school seniors. And she is a mom already for both a young son and a daughter. So she's coming from both the professional background, but also kind of like I get it as a mama background, which I think is really cool. So Suzanne, thank you for being here and sharing your expertise with our community. And I want you to share with everybody first, because I love that you call yourself the alchemist and the anxiety alchemist. So can you kind of tell everybody where that comes from and why do you call yourself that?
Sure. So alchemy, as we know it from all those years ago, alchemists were chemists, and they were pretty much like people who created solutions. And I think that one of the things that I strive for in my work with clients is I'm very solution focused in my therapy. Yeah, we can go back into the nitty gritty as to why you might do things and family history, and let's talk about childhood and all of that stuff. But when I'm meeting with clients, especially those who have a lot of anxiety, it's really solution focused, because we have to work on strategies to get through your day to day. Because when you're dealing with anxiety and even panic disorders, it doesn't matter what happened in your childhood. It matters how you can't function day to day. So you need real skills and strategies that are realistic for you to apply. So whereas I have a myriad of almost like generic solutions and strategies, I really tailor what I do with my clients specifically to where they're currently at in their day-to-day functioning, and develop strategies and so essentially a program that's going to be fit for their needs in that moment. Because not everything works for everybody. It's not one size fits all. So it's kind of like
And I love that you're solution oriented, because I think that's a lot of times we talk about things in such generalities, and then we're like, okay, we watched this live or this webinar, we listened to this podcast, but I have nothing tangible that I can go home and actually do now.
Exactly. Right.
So I know you wanted to kind of share, you have, is it 5 anxiety triggers that are for most people?
I have some anxiety triggers, yeah, for most people. Yeah. Mm-hmm.
Okay, so I'm going to turn it over to you. You just
Okay.
get started. I know we're so you guys know we're going to talk a little bit about things that are general for everybody.
Right.
We'll move in a little bit if you are a parent who has a medically frail child, kind of specifically how that heightens your anxiety,
Mm-hmm.
and then we'll end a little bit with like what's really the difference between where you go from stress to actual anxiety, where you might need some extra help. But I'm going to just turn it over to you now.
Okay, cool. Sounds good. And so I guess what Tara was saying is all of us experience anxiety on some level almost every single day of our life. And there's anxiety that's extremely healthy. It's kind of like that fight or flight response. So if you imagine driving down the highway and somebody's like coming up your butt in a car, you're going to get really anxious and stressed, and it's going to cause you to change lanes and to avoid that person. And that's a really good example of a healthy based anxiety. And we'll get into it a little bit deeper later on in the discussion. But when we talk about other anxiety, debilitating anxiety, that's really your inability to function on a day-to-day basis because of everything that's plaguing you inside your mind, inside your body. So we'll get into that. So but the point of this all is that there are things that we do every day in our life that, whether we realize it or not, kind of amps up that anxiety for us. And everybody can relate to these things that I've kind of, in my mind, like processed over time working with clients and just friends and family and even myself. So, one of the biggest triggers of anxiety for us, we live in a society where there are so many expectations for us personally and that other people might have of us. And that's like insane and crazy. So when you think about that, like if I'm breaking it down for you guys, think about your own expectations that you have of yourself, right? So you might be a parent. You might have a job, a full-time job. You might be on like 800 committees connected to your kids. You might have all of these activities that you want to bring your kids to. The expectations are so high, and it seems like almost every other day, if not every day, you're getting another email or you're getting something to sign up for, something to do. And you feel like if you don't do all of the things, that you're not going to be the best version of yourself. You have expectations about maybe how you should talk to your kids. And if you are losing your mind one day and you yell at your kids and you fly off the handle, you really come down on yourself because you're not being the best version of who you can be. So the expectations that we set for ourselves really can trigger that anxiety, because are our expectations realistic? And most likely they're not. And it's one of the biggest triggers of anxiety and stress, because if we're not living up to that level, then we feel inadequate, right? Take social media, for example. I love to call social media. I love it. I think it's great. I think it's a great way to connect. Clearly, Tara, we wouldn't be connected if it weren't for social media, and all the things that you've been able to do for the community that you work with. I think that social media plays a really great role in that respect, but it also doesn't play a great role in our expectations, because what is social media? It's a highlight reel. Most people are putting things on social media. They're putting like the great, awesome things that are happening, and you don't see what's beneath that all. So I think that also, if we're not doing what that person X, Y, and Z is doing, like what's wrong with us? They work a job, they have kids, they have a family, and they're doing all these amazing things. So that really, again, those are anxiety triggers. Those things can amp up our anxiety. So how do you deal with that? How do you lower your expectations, which sounds kind of backwards, right? Because we live in a place, and I think most of us were brought up to have high expectations of ourselves. So what I like to say about that is when you're driving somewhere for the first time and you're following directions, or I was just going to say MapQuest and totally date myself, but you're following Google Maps and you're not sure where you're going, and you're listening to the radio, like what do we usually do to concentrate more on what we're doing when we're driving? We usually like turn down the radio, right? We're like, if I turn down the radio, I'm going to be able to follow this map.
I do that all the time.
Right. And you're like, what the hell am I doing? Like, this makes no sense. But if you think about that analogy and think about your expectations, think about that being like you're cranking up your favorite tune and you're looking for the place that you haven't been to, you're following directions. And if you imagine your expectations being totally cranked up on a volume knob, think about like turning the volume down a little bit. And then think about turning it down a little bit more. You have to lower your expectations of yourself. Look, if you fly off the handle and yell at your kids one day and your windows are open because it's open window season and your neighbors are hearing, who cares? Because you're human and you're in the moment. You can always use that as a teaching tool to your kids and say, you know what? sometimes I lose my mind, or sometimes I don't make the right choices. And you can use that as a teachable moment. You don't always have to have these high, crazy expectations of yourself, because when you do, most likely it leads to disappointment and feeling inadequate. And that's not an okay way to live. And that can certainly amp up your anxiety. So that's like the first piece of wisdom that I can embark on you guys. Lowering
I really
that
love that. I love the dial, because that's something that we can actually like visualize.
Yes.
And say, okay, I've got my dial all the way up here at the end.
Yeah.
You know, I love that.
Absolutely. And that's what, like, I love using those examples with people, because I think that we all know what that's like, and we can imagine physically doing it and feeling it and touching it. So thank you for that. So the next thing I want to talk about is the word no. How hard is it to say the word no? You know, some of us, it's not that hard, but I think the majority of us have a difficult time, similar to what I was talking about with expectations. You know, if I don't do this, then what's going to happen? I'm going to have the fear of missing out. That FOMO is going to kick in. Or if I don't sign my kid up for that 800th activity, they're not going to be like their friends, or they're going to feel bad. Or if I don't accept that invitation to that third birthday party this weekend that I'm dragging my kid to, oh my God, like that's going to be the end of the world. But really having the power to say no to things, because most likely there are things that you're saying yes to that aren't like your favorite things to do, you know, like, and it's okay to say no. You know, what do we fear when we say no to things? We fear disappointing other people. We also fear that, what am I missing out on? And there are so many other things that come into play with that. So I really empower everybody to find something in their week that isn't really their favorite thing to do, that they can truly say no to, and to feel okay about saying no. I've heard this phrase a while ago. I don't remember where I heard it from, but I love it. There's that saying of FOMO, fear of missing out, but I love the saying JOMO. It's the joy of missing out. I think that's fantastic, because, you know, I know that there have been things that I have said no to that maybe in the end I was like, maybe I wanted to go, maybe I didn't. But then after the fact, I was so glad that I had one less thing on my plate to do. And I didn't feel like I was rushing around like a crazy person, because the more we stack our schedule we expect of ourselves, the more we stack our schedule with things that aren't pleasurable to us, the more we become anxious and stressed. So definitely being okay with saying no, and teaching that to your kids too, for sure.
Yeah, one of the things I've had to really work on, and this kind of just gave me a flat, like, since it's a blanket that I just have in my life all the time, I don't have to think about it, is that when somebody asks me to do something or participate in something or be part of something, I say, okay, I'll have to think about that and let you know in 24 hours. And I give myself a 24-hour buffer, so that I don't, because I'm one of those people who's very quick to be like, oh yes, that sounds great. Or, oh yes, I'd like to say. And then, you know, 2 hours earlier, you're like, why did I say yes to that? But if I just make it a standard that I don't respond to anything, then I don't, in the moment, I'm not like, well, maybe I should say yes. I'm like, oh, I always have 24 hours to think about it. And then it just seems to kind of help me not react. And then I can give myself some space so I can respond to, do I really want to do that? And I know that's been pretty helpful.
That's awesome, because even if you know you're going to say yes to it, I think that just using that strategy, that's going to be your go-to. And I think that's who can't accept that, you know, okay, that's acceptable to give a 24-hour answer, you know?
Yeah. Cause sometimes like these are really great ideas, or they're things that you want to be part of. Like they're not the things that you're like, oh, I don't want to do, but I've learned I can't say yes to everything. And so having to kind of like weigh that out, is that really ultimately like it's an 8 on the scale, but is it a 10?
Right. You know? Exactly. Yeah. Exactly.
I like your JOMO. That's cool.
Yeah. Right. The joy of missing out. Yeah. I'm so glad I didn't do this. Yeah. It's great. Especially when you're like, if there's, I don't know, there's something like late at night, or friends and family or whoever is going out, and you're like, oh, it'd be really cool to go hang out. But then you're like cozy on your couch. You're like, I really like it here. This is better. Yeah. So that's one of them. And and one of the other bigger ones in terms of things that we do every day that we don't realize triggers anxiety is making lists. So lists are, and you're like, what? How is that triggering anxiety? So exactly. And this is the look I usually get from my clients, because on one hand, I do promote being able to put your thoughts on paper and writing everything down that you have to do, because it helps you organize your thoughts It gets it out of your head. It gets it, you know, you can make a plan for it. But what usually happens when we make lists? How many things do we have on our list? Do we have exactly. Do we have a whole bunch of stuff on our list? And then what happens when we don't complete the things on our list that day? They go to the next day. And then what happens to us when we don't complete the things on the list? We're like, holy crap, now I got to add this to the next day. And it's like, you know, I laugh with my clients. I'm like, we make lists to be less anxious, but then our lists completely make us anxious. So like, it's like I'm getting anxious over my list. And that defeats the purpose of making them. So my simple strategy for that is I love the number 3. I don't know why, but it's always been a number that's seems manageable. So my advice is making lists is great, but try to limit your list to about 3 things. And it doesn't mean you can accomplish the 3 things and then you can start another list of 3 things. But if we have that, you know, when you do something, you accomplish something and you cross it off your list or you throw the piece of paper away, it really makes us feel good. And it makes us feel like we've achieved and accomplished whatever it is that we need to. So the less you have, and it's lowering your expectations again, lowering your ability to do the 800 things on your list. I'm going to do 3 things on my list. And then when I finish those 3 things, I'll add 1 or 2 more things to my list, and doing it in small broken down pieces, you know, so that you don't overwhelm yourself with everything you have to do.
I have to say, even just hearing that, I don't know about you guys watching, but I felt like, like just you saying that. And I think it's because I've always been trained that we make a list of 6 most important things to do. You know, it's that kind of famous 6 most important list.
Yes.
And I love a brain dump because I can dump everything out of my brain and get it onto a piece of paper. But I notice that when I start to take those things off of the brain dump and make my list for that day, I always underestimate the amount of time something is going to take me to do.
Yeah.
So I think like, okay, I'll get this done, this done, this done, this done, this done. I have my list now of like my 6 things. And those things take longer than I think they're going to take. And then I don't get them all done. And then I don't feel good about the 2 or the 3 things that I got done. I feel bad about the 2 or 3 things that I didn't get to because I ran out of time. And then I'm beating myself up about like, you know, everybody else can do all this stuff and I only got 2 things done. So you just kind of giving permission and saying, hey, just put 3. I'm like, I could probably do 3. Like that feels great.
Right? Because everybody can do 3 things in a day. Everybody. I don't care what it is. You can do it. Right?
Yeah.
And that comment that you made, Tara, about accomplishing, but then focusing on what I didn't accomplish and kind of beating yourself down is a very nice segue into what I'm going to talk about next, which is just again, this all aligns, saying no, lowering expectations, you know, not putting a lot on your list. It's all kind of under the same umbrella, that giving yourself praise for what you accomplish and giving yourself, recognizing what you're doing well versus what you're not doing well. And I think that is so important. We always fall short of that. We always focus on what we aren't doing, what we aren't getting, what we don't have, what we haven't accomplished. But we're completely eliminating the fact that we are doing so many hard things every day, you know, especially when we talk about families that are connected to children who are medically fragile or children who have developmental disabilities. You know, the amount of weight that's put on you guys is completely unimaginable for people who have not gone through that or aren't in that place in their life. And recognizing that every single day I'm getting up, I'm showing up, I'm breathing, I'm here for my kid, and all of the things that you're able to do rather than how you feel inadequate, building yourself up and recognizing the accomplishments and the wins for the day, even if it's, you know, doing the 3 things on your list versus the 10 things that were on your list. Always being your best cheerleader, because that goes a very long way, especially when you feel anxious. You have to look at what you know to be true and what you have accomplished versus what you have not accomplished.
Yeah, and it's interesting. I think that it changes too. Like I'm thinking in my entrepreneurial life, one of the things that I sometimes have to stop, because, you know, a day will go by and I've worked in my office and I still have my list of things that need to get done. And I'll have to really stop and give it like, and think for a second and be like, okay, but what did I do today? Because I feel like I did nothing. You know, even though I've been working now in my office all day, I feel like I actually accomplished nothing because there wasn't maybe like a big milestone type thing. And having to sit down and like, okay, but I did do this and I did do this and I did do this. And like, there were things that I accomplished. I think in the medical world, like there was a point, and maybe you can speak to this more if you're, you know, a parent kind of in that, whether it's long-term or short-term, everything, number one, takes longer if you're dealing with a child, you know, who's medically ill. I remember getting ready, you know, when I used to get Emily ready for bed at night, it was like a full hour process of line flushing and tubes feeding and all this medical equipment and syringes and everything. And being like, I was taking out a garbage bag full of stuff every night. And so, you know, there were times of just feeling like I got nothing done. I did not shower. I didn't, you know, do anything, but at least we both ate that day, and I, you know, survived. Like sometimes just surviving was like something that I could, you know, put on that list. So anything that you would say specifically more for those parents who are just in that, where everything feels so overwhelming. And then you add on just the regular life stuff, right?
Absolutely. And I think that the point that you made about when you talked about like having that garbage bag filled with the medical supplies and the syringes and everything, I had a moment myself where I just was envisioning you doing that, and unimaginable what that must be like for people.
Yeah. And you know,
like just that visual is.
And I think when you're in it, the thing that I kept reminding myself, because at one point she had more medical supplies in her room than toys. And remember thinking to myself, this is super frustrating right now, but it's not always going to be like this. And we're just going to get through this and get to, you know, it's not always going to be like this. And unfortunately, in my situation, it wasn't a chronic illness. It was, you know, when you're dealing with cancer, it was like, this is going to end, good or bad. Like, I don't know the outcome that's going to happen, but it's either going to end and she's going to survive, or she's not going to survive and it's going to end. But either way, this is going to be a temporary situation. And so maybe there's a different way of with the mindset with that versus somebody who's really dealing with a child with a chronic illness, that this is going to be forever. But even with that, I would say, like, I noticed some of the things. So for example, she wears hearing aids, and when she first got them, and she was for teaching other people to put them in, and me putting them in, and it made me nervous to touch her ear. And it seemed like a really big deal, where now, I mean, I forget she wears them. I have nothing to do with them. The only time I even think about them is when she's like, Mom, you need to call and get me more batteries. I mean, I have nothing to do with them. So I would think even then, if you have a child who is medically ill, that, or with a chronic illness, that as they get older, they do things more and more for themselves. And so like, I'm thinking diabetes maybe, you know, and I don't know too much about that, but you know, you must be pretty hands-on as a mom when they're little, but then as they get older, they're going to manage more of their own insulin. And so even that, even though that, it's not going to go away, it's going to be different on the anxiety that it has on us. I would think. So I know, you know, for me at least, it was just always kind of reminding myself, like, it's a season, it's not forever, you know, because you get caught up in that moment, and that anxiety feels like, oh, I'm not going to get through this.
Right. And doing what you need to do in the moment to say, this is, you know, and now you're in a place with the hearing aids, for example, where you probably never imagined when she was 4 that you would be in the place that you're at now with that. And that stuff does take shape and it does change. So keeping in mind that this is what I'm dealing with now, but this is not going to be forever. There's going to be a change and something else. I'm going to have to deal with it the way that I'm dealing with it now. But I'm going to be able to move to get past this to some extent.
And I keep going back to your 3 lists, because I think that's so powerful. I hope you guys really listen to that, because there's, to me, it felt so light when you said that, because even just having, like, let's say your kid's ill, and you do have an hour routine getting them to bed, that just might be one of the things on the list. And it's just that every night I get through that, and you can feel good being like, check that off, got my kid to bed with all their medicine. Like, that's, you know, because we feel so good when we check it off. Like, yes, I'm, you know, so
absolutely.
I love that. That's
great. And
okay, what other tips do you have for us?
So the other tips is, you kind of mentioned it too, as you were talking about, you know, what you endured with your daughter. And you said, sometimes I didn't even have time to take a shower or care for myself. So self-care for sure. And understandable that it's really hard to put yourself first in general, but especially when when you have a medically fragile child, or everything else that you might be dealing with a kid with an illness like that. And we always do tend to put ourselves last, and especially as women too, but being able to take, even if it's 5 minutes, even if it's 10 minutes, giving yourself that shower, even if it's just a body shower and you forget about your hair and do the dry shampoo thing, you know, but doing something for yourself, even if it's 5 or 10 minutes in the day, because you have to recharge. You know, one of my favorite visuals is when you get on an airplane and the flight attendants say, okay, like, they're going over the safety instructions. They say, when the oxygen mask comes down, what do they say? You need to put it on yourself first before you can give it to anybody else. And I know, just as, you know, for myself, when I hear that, I'm like, well, what if this elderly person is sitting next to me, or what if my own kids? And, we think about who else we can help first and how it's going to impact them if we help ourselves first. But when you think about that specifically, if you don't have the oxygen mask on yourself, you're not breathing. So you can't help anybody else if you're not breathing. And that's the same thing about self-care. Even if it's 10 minutes, you have to refill your cup every single day, whatever that looks like for you, to be able to be the best version of yourself for your kids or for anybody else. And that is so important. And I know it's really difficult sometimes to do that, but it's so key to be able to reduce that anxiety and stress, and just to be able to feel more present. It doesn't matter what it is, whether it could be journaling, it could be meditating, it could be taking a shower, it could be having a cup of coffee in silence. Whatever that means for you, it really is important to engage in some form of self-care every single day.
So I'm curious, when you're working with clients and you're kind of encouraging them to do self-care, and maybe, either they've never done any self-care, they've never thought about like actually planning self-care, or you have somebody, again, kind of like in a crisis situation where life is upside down, and you're kind of saying, okay, now put some self-care, and they're going, I just don't have time to shower.
What? Yeah.
What have you found as like, in general with your clients, like the most common or the easiest or the most effective types of self-care that they do that seems to have the biggest impact?
I think journaling is a huge one, being able to write some stuff down. I think that's a huge, huge piece of it, even if it's taking time to say, like, this is what I accomplished today, or this is what I feel good about, or these are some really good qualities about myself, or this is how I helped somebody today. Very simple strategies like that. There's an app that I love it's a free app on any phone, of course. It's called Happy Not Perfect. It's excellent. I use it with my clients. I use it with myself. I use it with my kids. You can be on this app for 3 minutes. You could be on this app for 15 minutes. And what it does is it takes you through just a really quick check-in with how you're doing. You identify a feeling. It gives you something to do with that feeling. You can go into a meditation if you have a little more time, but it's something that's like very fast, and we all have our phones on us all the time, mostly. And it's a really quick click of a button that you can do for that. And breathing too. I mean, that's not for everybody, but I think just recognizing that you're in a place of stress and just saying, okay, let me just take 3 deep breaths right now. That kind of helps sometimes too, helps to center you. Sometimes when I work with kids with breathing, I have them envision, I call it box breathing. So they take a deep breath in, and when they breathe out, they imagine drawing a line on a box. Then they do another breath, then they do another breath, and another breath. So you're visualizing something, and you're breathing too. So at the same time, you're calming yourself a little bit. So those are a couple of different strategies.
So it's interesting that you say journaling. That was kind of the first thing that came out, because it's something that I talk a lot about, like having a gratitude practice and stuff like that. And I don't know that I ever think of that really as self-care.
Yeah. Absolutely.
I think of self-care as like, okay, I've got to go take a bath, or I have to go, take a bubble bath, or I need to go take a walk, or I need to go, find something out of my time to go do something. And that seems so simple to be able to say, you can journal when you're tired, and you don't need to go anywhere or do anything. And I never thought of that as self-care.
Yeah. Absolutely.
I love that.
Even if the act of physically writing, maybe if you don't have a moment to do that, or you don't have a pen and paper with you, even just in your head, what are 3 things that I'm grateful for today? Or what are 3 things, just doing something like that. You don't even have to have something physically to write on, but that is definitely self-care, because you're taking a moment and you're being self-reflective. And sure, I mean, you could go for a walk, but a lot of times those things are really difficult to do.
Yeah. Okay. Anything else?
I think that's all for that piece of it. Yeah.
Perfect. So, have you worked, or have you seen, like, when anxiety is heightened when you're dealing with medically frail kids or parents that are in kind of more of a crisis situation? Any tips on, when do you kind of know, like, okay, this is anxiety, and this makes sense because of the situation, versus just regular worry and stress and things that we kind of, go through regularly. And then if you how do you know, like, okay, it's escalating to a different level?
Okay, so again, I'm a huge analogy maker, and I think that that's just realistic for most people. So I'm going to use another example about driving. So everybody, just picture yourself like driving on a highway or driving whatever, and sometimes we all like have a million things in our head, and we kind of like space out for a minute, and then all of a sudden, like a car gets too close for you, and your heart starts beating. You're like, oh my god, and like you swerve, and your heart's really, and the car's past you, and you're fine, but like your heart's really beating, and you're like thinking, oh my gosh, what if they hit me? What if this happened? And you're having that instant moment of anxiety and panic, but as the car drives away and as you keep driving, like you're fine. It kind of comes and goes very quickly, right? Now imagine standing in your kitchen in the morning when your coffee pot's making coffee, and that feeling that I just described just comes out of nowhere. And that's how you feel almost all the time. That's the difference between stress and anxiety. There's moments that can stress us out, but then we recover from them pretty quickly. But then anxiety is like feeling like that all the time.
So when I picture that, and I love that because it's that visual, and what I'm kind of hearing is, okay, but that anxiety seems to be coming out of nowhere, where you're going, why am I feeling anxious for no reason? And I'm thinking, again, like if you have a circumstance going on, a medically ill child or a major situation in your head, you kind of go, well, I'm feeling anxious because I have this going on. That's the car that's driving by me all the time, 24 hours a day, 7 days a week kind of thing. And so and I guess because obviously anxiety has health, risks. And so where do you know, okay, I'm at a point where now this is maybe really a health risk,
right?
Versus being able to be in this circumstance or this situation, but be able to manage my worry and my stress and my fear.
So I would say the simple answer, and there might not always be one, but the best way I can break that down is if you are feeling that anxious almost all of the time, and it's impacting your ability to do whatever it is that you're doing in your life, whether it's day-to-day activities, whether it's work, whether it's being like present when you're in those, when you're with your doctors and they're giving you information and you're like, you can't even focus or pay attention. That's when it's a red flag to say, okay, I can't handle this on my own. And I probably need to go see somebody. I probably need to go see someone almost on a regular basis to get this a little bit under control and subsided. So that's like the extreme version of that. And certainly if you're experiencing panic attacks, if you're having a racing heart, if you feel, a lot of panic attacks, the most common place where they're diagnosed is in an emergency room. And that's because most people think that they're having a heart attack when they experience panic. And most of the time, it's panic related. That's where most of that is really diagnosed. So when you're having those physical symptoms, really bad headaches, you're getting shaky, you're getting fidgety, you're almost like a lot of people describe feeling in a position where they feel like they're going to die because they're just so anxious and overwhelmed. That's when you need to seek medical help. And it's great. I know that a lot of people rely on their family and their friends and networks as you have done with with Making Cancer Fun, like networks of people who are in the same kind of situations that they're in. And those are great supports. But when you're actually struggling, more than struggling on a day-to-day basis with it, you really need to get some extra professional supports in there for you. And it's not a bad thing. Yeah. It's okay. It's no different than if you broke your leg or if you had flu-like symptoms or if you had a virus, you would go to a doctor, they would help you, they would give you treatment. It's the same kind of thing that you need help to get past that.
So I'd love for you to talk about this just a little bit more, because one of the things that I hear back from people, particularly in the medical world, is that when they got a diagnosis or something happened, nobody really around them suggested getting mental health support services for them. We might talk about that for the patient, oh, your kid might need this, right? And what's interesting, at least in the childhood cancer world, we know studies show that the parents and the siblings have a higher rate of post-traumatic stress disorder after than the actual patient. And I don't know, all the causes behind that. But I've had families say, nobody ever even said, hey, would you like some support and services? And I wonder, because I know for me, and I think we've talked about, there's a little bit of like this stigma, I think, is changing. However, one of the things that I wonder if it prohibits us from wanting to say like, hey, I think my worry and my stress is at a different level, I might need some help, is that my first thought is, oh, all they're going to do is put me on a pill. They're just going to medicate me. I have anxiety.
Right.
And so they're going to be like, here's your prescription. And so
Right.
I don't want to take anything. I'm already giving my kid all this stuff, or for whatever, you know, I don't want to become a zombie. And so I'm just going to work through my anxiety because I don't want to just go on medicine. So for somebody who maybe is reluctant to see someone like you, or reluctant to seek out, because that's kind of what and openly, that's my thought process, right?
Sure.
What would you say to that person?
Well, I would say there's different levels of therapy. So for example, I'm a licensed clinical social worker. I'm a psychotherapist. I cannot prescribe medication. So when I'm seeing somebody, I'm working with them on just psychotherapy, on strategies, on having them understand their anxiety and work through that. I cannot prescribe medication. So that wouldn't be my wheelhouse. A psychiatrist or a physician or a neurologist, they would be in a position to prescribe a medication. And odds are, if you go to a psychiatrist and you're anxious, they're going to recommend a medication, because that's pretty much what they do. Very few psychiatrists will engage in psychotherapy, because that's just not, they'll do it if they can, but that's really not what they're equipped for. They're equipped for the medical piece of it. So I would say if you're considering doing that, and there is that you don't want to be prescribed a medication, seek out a psychologist, a psychotherapist, a licensed clinical social worker. Seek out one of those professions before going to a psychiatrist or to a medical doctor. And certainly, with that said, I am not a pusher of medication at all, but certainly if I'm working with my clients and I'm giving them strategies, and we're working through some of these strategies and things aren't working for them, or they're not able to access those strategies because the anxiety is so prevalent, then I might recommend that they do see somebody in addition to me, because sometimes a medication can take the edge off just enough to be able to access the strategies that you need to access. Medication's not going to make your anxiety go away. It's going to take the edge off so that you can function, but you need to have strategies too, because you can function, but you need to know how to deal with it, the anxiety as well, if that makes sense.
Yeah. And that was going to be my next question. I'm assuming if somebody starts working with someone like you, then you have a professional who maybe can help you decide, like, you know, are these tools enough that you can use on your own or not? I had it described to me because before my divorce, before Emily's cancer and everything, I had gotten diagnosed with situational anxiety and depression. And at the time they attributed it to me being a new mom. And now looking back, it was really, you know, I was in a pretty bad, horrific, like abusive relationship that wasn't, like, I was kind of blind to what was going on. And so, and I remember going through like this depression, this anxiety, and being very reluctant. I didn't want to take any medicine. And years later, somebody described it to me as a Band-Aid. And I said, because that was my whole thing. I don't want to just put a Band-Aid on the problem. And they said, but sometimes you need to put a Band-Aid on to heal. Like, that's why we put Band-Aids on, so that your body has a chance to heal. And that made it feel like, oh, that makes sense. This doesn't mean that I'm weak or that I can't. I'm just trying to create that, you know, take care of the symptom and not tackle the real root wound. Right. But maybe putting that Band-Aid on will help me heal this wound. And I think that's huge. And I often attribute now that, you know, thank goodness I went on medication during that season, because I remember all of a sudden it was like I started to feel like myself again. And unfortunately, because I started to feel like myself again, that's where I started to go, wait a minute, what's going on here is not right. Like, I'm not going to put up with this. I'm not okay with that. And I think it was really quickly, within like 6 months, was like the end of my marriage, which ended in a domestic violence incident. But the reason it escalated to that was because for the first time in years and years, I finally was like, no, I'm not crazy. Like, I'm not, you know, like, because I felt like myself. It was the only way I could describe it. I said, I felt like felt like me was back. And I had lost myself over all those years of being in this like really, really abusive relationship. So I mean, I think everybody's situation is different. But for me, I feel like had I not seeked out that support and gotten on the medication openly, I think I would have ended up in a like a psychiatric hospital. I would have had a nervous breakdown and would have like just because I thought I was going crazy at that point. I mean, the psychological abuse was so severe that I remember even talking to my first therapist and saying, I think I'm crazy. And her being like, and she, you know, was an expert in domestic violence. And she was like, I don't think you're crazy. And I remember sitting there, Suzanne, and I was like, oh, once she gets to know me, she'll realize I am. But it was through the therapy, that I remember one day and learning and education and reading and understanding more and being like, oh, I'm not crazy. I was never crazy. I was married to crazy, but I wasn't crazy.
Right. And how empowering and validating for you to get to that place.
All of a sudden it was like being an onion and having like all of these layers peeled off and one day kind of waking up. And so I do see now how like they work hand in hand, you know, you can't,
sure.
It's so powerful. So I love that. And I love that you're talking about like who maybe you should seek out to see if that's a barrier to wanting to get support. Maybe start with a licensed clinical social worker, someone like you know.
Yes.
And then anything else that you want to add?
Yeah, just do we have time? Because I'd love to share some strategies.
Yes.
Is that okay?
Yeah.
So okay. So a couple of strategies that, and these are not, again, like I said, they're not one size fits all. So certainly attempting and trying these things, you might have to try them a couple of times, or there might be one that stands out for you that works versus the other one. So, but I think the first one is relevant to everybody. One of the things with anxiety, the first thing I teach to my clients is being able to accept your anxiety when it happens. And that does sound counterproductive because most of the time when we feel anxious, or clients that I work with who panic, or clients that I work with who, you know, have extreme anxiety, when they feel it coming on, they get, I don't want this to happen. It's going to come on. What's going to happen? I'm in this situation. I can't be anxious. And they snowball their anxiety and they try to push it away. But the more they push it away, the more it comes. So I think that being able to accept that your anxiety is happening and also accept that it's not going to be there forever, and going with it versus going against it is a huge step. And when clients are able to realize this, and it takes a long time to be able to do this, but when clients are able to make that connection, it's almost like they come in and I see a difference in them physically. Like they're a little more relaxed. They're a little more go with the flow. They're a little more able to utilize other strategies because they're accepting of what's happening. You know, anxiety is a habit at the end of the day. Yes, it's an emotional, you know, mental health condition, but we habitually, anxiety becomes a habit because it becomes a way that we cope with or whatever is going on. It's a maladaptive coping strategy that we develop, and it becomes a habit. So one of the things when we're looking to strategies to be able to take control of our anxiety is, if you think about a habit like a record, right? A habit's like a record. It's going around and around and around. These strategies are there to skip the record, because the more we skip a record of our habits, we're completely changing the framework of them and we're disrupting the flow of them, which is going to create us to be able to change and take more control, if that makes sense. So accepting the flow of your anxiety, envisioning yourself like a really big, stable oak tree. When there's a really severe windstorm, an oak tree doesn't stay stiff at the top. An oak tree goes with the wind, because if they stay stiff, their branches are going to break off. You have to go with the flow when you're feeling that anxiety. And that takes work, you know? So that's the first thing, you know, and then the next things I'm going to describe are things that you can try for yourself. So I love using, and I think you mentioned something like this, Tara. I love using a scale of 1 to 10 to rate things, right? So giving your anxiety a rating on a scale of 1 to 10, with 1 being I'm not anxious at all, and 10 being this is like the most anxious feeling I've ever had in my life. Where are you on that scale? Because sometimes when you take a moment and step away and you break it down, what you thought was a 10, maybe it's a 5 or maybe it's a 6. And then you can say to yourself, okay, well, that's not as bad as it used to be. So just by giving something a rating, it kind of takes that edge off a little bit. So that's a really good strategy to use. The other thing is, I kind of mentioned this before when I was talking about some of the 5 culprits of anxiety, is using the facts of what you know to be true. So a lot of times anxiety is worrying about things that have not happened yet. Depression's worrying about things that have happened, like worrying about the past. So when you're in that moment and you're like, oh my God, like I'm worried about 6 months down the road or a year down the road, or I'm worried about blah, 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 blah. What do you know to be true about the situation? And if you've been in a similar situation before, what do you know true historically about how you've handled that and how you've gotten through it? So again, you're taking a step back away from that panic moment and you're looking at the facts. This is a huge strategy that mostly all of my clients, when they get this and they make that connection, it really makes a huge difference in their ability to cope. Because you can't argue with facts, right? You can't argue with what you know to be true, which is huge.
I love that you based it on stuff that you've already done.
Yeah.
Because it's like you're reminding yourself how strong you are.
Yeah, exactly. And it goes back to what you said, like recognizing my strengths versus what I'm worried about or haven't done yet or haven't accomplished, for sure. The next one is more of it's like a physical activity. So I'm a very visual person, and a lot of my clients tend to be as well. So I think we all have sticky notes like in our arsenal, right? So what I like to do with this is it's really about, the phrase I love using is controlling your controllables. So when we're anxious, sometimes there are things that we're anxious about that truly are not in our control. And we worry about things like, simple example, that let's just say you have a huge outdoor event planned and there's really crappy weather in the forecast. It's going to pour or rain or snow, and you're worried about what the weather's going to be. That's out of your control. You can't do anything about that. But what you can do is make an alternative plan, right? And so that kind of eliminates that worry of the weather, because I know what I'm going to do. I'm going to control the things that I can control. So what I like to do with sticky notes is, whether you use a wall for this or whether you use a piece of paper or a big piece of like oak tag, is make categories. Things I have no control over, things I absolutely can control and do something about right now, and things that maybe I can control in the future, but I can't do it right now. And then you write down all the things that you're worried about on these sticky notes, and you categorize them and you put them in different categories. And I like sticky notes because you can move them. And sometimes some of the things that we feel like we can't control right now, when we have a moment of clarity and we think about them and come back to them, we realize that we can do something about, like the weather example. I can't control what the weather's going to do, but I can make an alternative plan. So that's a really good exercise that a lot of my clients really like, because they're also physically doing it. You're also physically writing something down and getting it out of here and getting it onto paper, which is pretty powerful. So
it would be on each Post-it, you're writing one word.
Mm-hmm. Yeah, or one phrase or something that you're worried about.
Yeah.
Right? Okay. So it's a pretty powerful strategy when you're able to do it.
And I think most of us think all of our stuff is going to go under the stuff that we can't control. And at the end, I'm really thinking this through. I'm thinking, okay, probably it's like one or two or three things that are in there, and more stuff is controllable than we realize.
Absolutely.
And like we're thinking like, oh, this is all happening to me.
Yep.
Actually, well, and so I'm curious. I'm asking, when you find clients who do that, where do most of their Post-its end up? In which category?
I would say that they mostly end up in things that they can control. And then the things that they realize they can't control, they're able to look at it and say, okay, that's not something I need to worry about now. And the other phrase that I use a lot with them is, what can you do about that right now, today, as we're sitting here? Can you do something about that today, right now? No. Okay, then what are we doing with that? Why are we worrying about that? Let's worry about what we can control right now, today. And I know that's easy for me to say, and sometimes it's hard to imagine doing that. But when you start to reframe the way that you think about things, it really does help and make a difference, for sure. And the other two things that I want to talk about really quick, certainly they can be applied to us as adults, but they're really good strategies that I use for a lot of the younger children that I work with. So when I work with a kid who has, we usually call them worries, but anxiety, and things that they're constantly plagued or worrying about, what I do with them is, anxiety can be really scary to all of us, but especially to young children, because it takes on a lot of forms. It could be fear, it could be them being scared of certain things. And what I do with them is I have them create what I call a worry monster. And I physically have them draw what they imagine this worry monster to look like. So they draw this worry monster, and then we give it a name. And usually I encourage them to give it a really ridiculous name, because so they've drawn the worry monster, they've given it a ridiculous name. By giving it a ridiculous name, they've taken the power away from it. And then what I usually have them do is I might have them put something like a silly item of clothing on it, like a party hat or something like ridiculous. So again, I'm eliminating the power from that worry monster. I'm taking it back. And then when we talk about our anxiety or worries, we use the monster's name. So if they call the monster like Fred, I don't know. And I say, okay, so what's Fred doing to you this week? What's going on? Oh, Fred's doing this. Well, what are you going to say to Fred? How are you going to tell Fred to stop doing that? And then they almost take on this, like, they take it on as a character. So it eliminates and reduces that that ability, like it gives them the control to be able to say something. They're talking out loud to their anxiety. They're taking back the control over it. And it's really it's a great exercise because it's something I usually keep it in my office, and we take them out if we need to take them out, and they work through their anxiety by projecting it onto this monster. So it really helps them get clear with working through everything that they're going through, if that makes sense.
Yeah, I love it.
Yeah. And I do that sometimes too with adults. I'm like, you don't have to draw it. You could if you want, but let's think about anxiety in that terms. If you had to talk to your anxiety, what would you say to it? And how would you talk to your anxiety, and how's your anxiety talking to you? And kind of like take that power away from it, so to speak. And with that said, like the other exercise is I like to create worry boxes for my kids too. So I'll take a shoebox and I'll have them decorate it. And essentially when they're worried or have these anxiety or these worries about whatever, they write it down, or if they can't write yet, they draw a picture and they take it, they draw it, they write it, they put it in the worry box. And the worry box, sometimes I have one in my office for my kids and it stays at my office. Sometimes I have parents like put it away in the parents' bedroom in a drawer somewhere so that the kid gets it out and they put it in the worry box, and the worry box is going to hold that for them. And when we work through that worry and we talk about, what did you put in the worry box this week? Oh, I'm afraid to go to sleep because I'm afraid I'm going to have that nightmare again. And we talk about that and we work through it. And once they don't have that worry anymore on a day-to-day basis, we tear it up and we throw it away. We're done with the worry now. It's gone. So those are two things that really help kids, a worry monster and a worry box, to get rid of those, to start to deal with those things.
I love the worry box, and I'll share with you. So I was taught in business the idea of compartmentalizing and like all these different shoe boxes, right? And it's really a strategy that we teach entrepreneurs who work at home.
Yes.
Like, you need to take your box out, and now I'm in work mode, and then I have to put it back, and now I'm in mom mode, and it kind of just helps you separate. And I use that a lot in the hospital. So for our medical mamas here, I use that strategy a lot when I was in the hospital, because I was dealing with, outside of her cancer, I was dealing with massive stuff going on with my ex-husband, restraining orders, court cases, multiple, instances with child protection services, and all of this ongoing court battle. And so I would be like leaving her room, going into the parents' lounge, and like logging onto the computer and filling out court documents, and then have to be on the phone with my attorney, and then need to hang up and go back into her room. And I was to deal with like the financial stuff of being a single parent and losing, no longer working and that income. And so it was like all of these different things. And I used to visualize that when I would walk into her room, I would take all of the court stuff, all of the financial stuff, all of the stuff that I had to deal with on the other side of the door, and like put it in a box.
Yes.
And put that box on the shelf and just be like, once I walk through this door, there's nothing I can do about any of that stuff while I'm in this room. And it allowed me to be present with her, because it was like almost like I'm not even going to let myself think about that right now, because there's no point, right? But the box will be there for me to pick back up when I walk back out the door. And so I like, obviously I didn't call it a worry box, but I guess that's really when you were describing that. I'm like, that's kind of what it was. I put all the worry in there.
Yeah, absolutely.
It's like, okay, it's still there. I'm not, I'm still acknowledging that it exists, but I'm not going to take it with me in a room where there's nothing, where I can't open it and do anything. Right. So, because I think, a lot of parents who are going through this medical stuff, it's like we're trying to be present with our kids, but we do have all of these worries. So I know you use it with children, but I'm thinking it's great for adults.
Yeah, absolutely.
We need to be there and be present. And, one of the things we talk a lot about in Making Cancer Fun is how you're a mirror for your child. So if you're filled with like fear and worry and anxiety, your child is picking that up. And the negative health benefits that they then experience from this. So I love this idea that it allows me to, kind of leave my fear, my worry, my anxiety at the door, and not bring that in to negatively impact my child.
Absolutely. I love that. And I can definitely visualize that for you and what that must have been like to have that strategy. And with that said, a lot of times as therapists, when we're going through grad school and we're doing all of our internships and stuff like that, we're kind of taught that we are kind of like those boxes. Like we hold our clients' worries, we hold their fears, we hold their feelings. And when you think about going to therapy, if you think about it as a big box, the therapist is there to hold and to help you process, but really to hold on to all of the stuff that's plaguing you. And it's almost like you're going into this place, you're dropping everything off, you're talking about it, and you're leaving but recognizing that you can leave that stuff with your therapist and then come back to it the next week or the next time you go to your session. And that really provides a lot of clarity too to people, having that same idea that you used, Tara, when you were in the hospital, having that compartmentalization.
I love that.
Yeah.
Anything else you want to share? I know we're longer than we anticipated.
Yeah, that always happens, doesn't it?
Oh my God.
Yeah.
So valuable. I'm like taking notes.
Yeah.
So anything else, or are we, because I want to make sure I wrote down the 5.
Yeah, no,
okay.
I think we're good. And just to share, I guess, with everybody that if there was anything that you heard today that was impactful to you, or if you need more information, I do, even though I'm, I work in an office in New Jersey, obviously we're all mobile these days, and we all can do things virtually too. I'm always open to have clarity conversations. If you need to process something, if you need advice on what to do, if you need something, I'm always open to have that with you.
So I know you have, and I do, because I want everybody to know how they can find you.
Yeah.
And so we'll be sending out an email to our community, whether you're on the Tara Voice, email list, or on the Making Cancer Fun email list, and I'll have all of Suzanne's contact information, her social media, her website, so you'll know how to find her. If you are watching this on YouTube, then if you go down into the, kind of description box, we'll have links to her website and to all of those places there that you can connect with her. I do know that if you go to, so if they go to your website, and tell us your website again.
My website is SuzanneOrlando.com.
So pretty easy to remember.
Easy to remember.
You can click on a link that will bring you where you can actually request a free discovery call.
Correct. Yes.
Okay. And so kind of what is that when you say this is a discovery call? What would somebody expect from that?
So what I do is I talk to you about what you might need. So if you're looking to do something, if you're, the strategies that I mentioned here today, and you're looking to get deeper into that and to really work on that, or have some support with that, or, to have me support you with that, it's basically a way for me to understand where you are, what your needs are, and to be able to give you some ideas of how we might be able to move forward. I have a couple of programs that I've developed through that website where it's all about supporting people and helping people really be the best versions of themselves. So the discovery call is just a place for me to understand where you are and how I might be able to help you further.
I love that before you said a clarity conversation, because that's so great, right? Because really what you're saying is, okay, I'm just gonna help you provide clarity into these strategies. And sometimes I think we get these ideas and we think, okay, these are great, I'm just going to incorporate these and I'm going to start using them on my own. And obviously I hope, that's when we do these webinars, right? We hope that people do that. And I do think though that there's real value in having somebody who can kind of help hold your hand through that process, hold you accountable, that you can get feedback to say like what's working, what's not working. Okay, you like this strategy, let me tweak it. And so what I love now is that sometimes, and having worked with different therapists throughout my life, right? Sometimes we're kind of limited to who's in our area or who's in a drivable distance, or certainly, I'm thinking about when I was in the hospital, I was trying to continue therapy because I had gone through therapy while I was going through my divorce and was trying to, but the person that I was seeing was so far from the hospital, like it became that I wasn't able to continue with her. And I love that you can work with a client virtually. So really, if you're just like, wow, okay, Suzanne, I connect with her. I like her way she thinks. I love her visuals. Like this really resonates with me, and she's who I'd want to work with. What's really cool is that we don't have those boundaries anymore. You can work with her regardless of where you live now.
Absolutely. Absolutely.
So I think that's fantastic. And what's really cool about something like this is that often when you go to work with a therapist or a social worker, like you don't really know who they are, and you have to spend money and a few sessions to even figure out if you vibe with them or jive with them, or you're good. And so what's great is we've had almost a whole hour kind of getting to know you a little bit, that I think you'll really know, like, hey, this mama really clicks with me.
Yeah.
She's like, I get it. I love her way of thinking. I love her strategies. I feel like she can really help me. And now you've saved yourself time and money. Because you're not going through those first 2 sessions just to even figure that out.
Yeah. And 100% the limited time factor. I mean, especially with dealing with medically fragile children, you don't have time on your side. That is something that you need to make the most out of. And that would be, having the ability to access that and not physically have to go anywhere is fantastic.
I think that's awesome. So thank you for joining us. If you are not getting our newsletter, www.makingcancerfun.com. So that's really easy. If you want to subscribe for the Tara Voice, then we'll drop that link in. But this way you won't miss these updates, and we'll send out in the next couple of days the update once we have the video loaded and everything with all of Suzanne's information. So you want to make sure you're subscribed beforehand so that you don't get to miss that on the back end, and that way you'll know how to find her. But if you're like anxious and you're like, I just want to get started right away, I really want to at least book a discovery call, just go to her website, SuzanneOrlando.com. And Suzanne, if you can maybe just even put that in the comments so people can just click on it and find you.
Yeah, absolutely.
That would be great. And thank you so much. You just gave so much wisdom and so much.
Of course. Thank you so much for having me.
I love these strategies. Good. I was writing these down. I'm like, this is fantastic. And I love giving for anxiety a rating, because to me, what that means is that you can almost gauge your process, your progress, and say, okay, I used to find a lot of mine were 9 and 10 and I'm 6. And so even though I'm still feeling anxiety, this is progress. I thought that was great. And my favorite thing that out of everything was learning to control your controllables, because we want to control everything.
Yes.
And so I love that phrase.
Yes, we do.
Controlling your controllables was really fabulous. So thank you. I just so appreciate you.
Of course. Thank you.
And if you guys want to send some love to Sam and maybe comment on what you got or what resonated with you, or just tell her thank you for being on here, make sure to fill out those comments. And if you're watching on a replay, that's cool too. Keep commenting so she can see that. All right. So thank you guys. Have a great afternoon. We'll see you next week on our Wednesday.
Thank you, Tara.
Bye.